Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our Hospital System General Director. Today is Thursday, July 30th, giving you the update from Albany Med. I can't believe it's almost August.
I know,
It's
Dennis.
unbelievable.
Absolutely.
Let's take a look at the numbers from the Capital Region. Currently, this graph looks exactly the same as it has for the last week or so. You're looking at 38 people currently in the hospital in the 8 counties being treated for COVID-19. The next graph is admissions and discharges to Albany Medical Center for people with COVID-19. Yesterday, 2 in, 2 out. Fred, interestingly on that graph, below the line in dark black are people who have died from COVID.
Right.
The last one we had was on July 5th. So we're coming on almost a month since somebody has passed from COVID-19.
And it's been over a month, Dennis, since we've had somebody in the ICU on a ventilator.
Yeah.
So it's a little bit different in the hospital.
Yes, for sure. Let's take a look at the morning census. This is the third graph. So this is Albany Medical Center. When we come in, how many people are in the hospital with COVID-19? And this graph really also looks pretty flat for the last couple weeks. We currently have 15 in the hospital. They're all on the floor, to your point.
That's right.
None in the ICU. So to our teams out there, our doctors, our nurses, respiratory therapists, social workers who are caring for that population, we should thank them again. It's been a while since we said we appreciate the hard work you're doing. And we've gotten some great letters recently from people who've been discharged from the hospital, having been cared by those teams. And they
including one of the patients from Queens.
From Queens,
yeah.
Which is really, we'll share that letter next week.
Okay.
It's a great letter for sure. Okay, a topic we haven't spoken about in a while is convalescent plasma. And Fred, you'll recall we were the first hospital in the region to use convalescent plasma.
Right.
We've used it on well over 100 people, and you would characterize it as being very successful.
It absolutely makes a difference, Dennis. It absolutely does.
Yeah, and the Red Cross has recently announced that there is actually a need for more convalescent plasma for a couple key reasons. And what would some of those be?
Well, first of all, Dennis, in the South and the West, there's been a real surge of COVID infections. And, it's following the same kind of pattern that we saw here. First, a lot of positives, then a lot of hospitalizations, and then, unfortunately, a lot of deaths. Yeah. So there are a lot of sick people in other parts of the country that would benefit from plasma.
Yeah. And we looked at this. We did a quality review, and we found out the outcomes of people at Albany Medical Center who received convalescent plasma was excellent.
Right, was better.
Yeah.
And the Mayo has shown the same thing. The second thing is, Dennis, it's the summertime, as you pointed out.
Right.
And there's always a drop-off in blood donation during the summer, and the Red Cross does its best to try to keep interest up in donating, but it does tail off a little bit. So those are at least 2 of the reasons why.
Yeah, and there are 2 populations I can think of who are eligible to donate. That would be people who had COVID, who knew that and have fully recovered.
Yep.
And there would be maybe some people who, for one reason or another, had tested positive for the antibodies. Maybe they were never sick, but they're eligible too.
Absolutely, both of them.
So we would encourage you. We know this community is very generous. We've received a tremendous outpouring in the beginning. To those who have yet to make that gift, you can do so. Reach out to the American Red Cross website, and I think there's some information there on eligibility, and it's very likely that would be used in this community here.
Absolutely.
Which is great.
And I'll throw another plug out. We do have a blood drive coming up here at the medical center. I think it's August 18th. It's a 1-day drive, an emergency drive. We'll give you more details in coming days.
All right, great. So it's a great way for people to give back. Fred, when people come into the hospital, we've talked about this, there's an ability to get in a little bit quicker called Fast Pass. And this is sort of similar to when you go to the airport and you have your information pre-loaded. Right. We're trying to encourage people to use this. It's been adopted, but not as much as we would have expected.
It's puzzling, isn't it, Dennis? Yeah. You would think that people would want to do this. A couple of simple questions online, and they get a pass to come in, and allows them to sort of get in quicker.
So with this video, in whatever forum you're watching it, it could be on our intranet, it could be on social media, there'll be a link. It could be above, it could be below, but look for the link and that'll give you the information on how to get that information filled out.
Yes.
All right, so very good. So Fast Pass. And then we promised, Fred, we would talk about vaccines. This is a really, I think, fun topic to talk about because a lot is happening. Let me tee it up and I'll let you take it from there. Operation Warp Speed is what it's called. Normally, vaccine development takes years. I mean,
Yes.
it could even take as much as a decade.
That's right.
Obviously, the entire global community is looking to make sure we have a vaccine that's safe as quickly as possible. Here in the United States, there are many different agencies working together under Operation Warp Speed. You have the CDC, the National Institute of Health, you have the Department of Defense, you have other agencies like the FDA, Department of Agriculture, billions of dollars. They started with 100 eligible candidate vaccines. They narrowed it down to 14, and then they started to get them working together quicker. And we've heard, Fred, in the news, some of these companies are starting to enter phase 3 trials. What does that mean?
So, Dennis, there are multiple phases of developing a vaccine, or for that matter, any drug. And so you start small. You first prove that it's safe.
Yes.
Then you prove that it does some of the things you want it to do, and then you ultimately get to a phase 3 trial where you give that drug or vaccine to a large population and see whether or not it accomplishes what you intend to have it accomplish. In this case, there are a couple of things that they're going to want to look at in those large phase 3 trials. First of all, they're blinded, so only half of the population is going to get the vaccine. The other half will get a placebo.
Okay.
And we'll want to see whether or not the population that gets the vaccine actually develops antibodies. Secondarily, they're going to also want to see what happens between the two populations on who gets infected, since we still have an ongoing pandemic. So that takes large numbers. So the trial that started this week by a company out of Boston called Moderna is looking to recruit 30,000 people.
30,000.
So 15,000 will get the vaccine and the boosters, and 15,000 will get placebo, and we'll see what happens.
And you mentioned boosters. So in that trial, they'll get the first shot, and then 28 days later, they'll get the booster.
That's right.
So it'll take probably the month of August for both of those to happen. And then I guess September, October, November, we'll start to see how the two different groups compare.
That's right.
And I assume other pharmaceutical companies are doing similar types of trials.
That's right, Dennis. I think they are. Normally, this would take so long because everything would be done in sequence.
Yes.
So that first phase trial for safety, then analyze the data, and then go to the little bit larger trial, and then ultimately this very large trial.
Okay.
And then only after the phase 3 trial proves that the vaccine or drug works, will the company start investing in producing it.
Okay.
All of this development is happening in parallel.
Right.
So nothing's being skipped, it's being done in parallel. It's being done faster as a result of that, including the development and production of the vaccine in anticipation of it working.
So if phase 3 is successful, they're already ready to roll it out.
They're already starting to produce it, so they'll be able to roll it out that much quicker. And that's where the governmental support comes in.
That's right.
Normally, a business would not do that because if it doesn't work...
Risk.
Yeah, absolutely. They've wasted hundreds of millions of dollars.
All right, it's very exciting to read about, and obviously we're all very hopeful that it will happen. And if we do get to that point, we're probably still looking at 2021.
I think so.
But we just wanted people to know that those things are happening. We're keeping a close eye on them, and we'll see. We'll update.
Yep, we'll update.
All right, very good. So as promised, next week we're going to start introducing some videos of people from our workforce. We're going to start with an update from the dean, as we mentioned, welcoming the incoming class and others as well. We look forward to doing that. And we'll give some update on our recruiting efforts. I think there's some efforts continuing to go on in that area as well.
We have some successes to talk about.
All right, very good.
One thing I would throw out today, there's a piece in the Gazette from a grateful patient.
Yes, thank you.
And I just wanted to do a shout out. So this was a patient who needed spine surgery and ultimately had spine surgery done by Bob Cheney, one of our spine surgeons.
Great surgeon.
Great guy, great surgeon. And it was an interesting letter because the patient talked about being afraid to come in because of COVID, but ultimately decided to come in.
Good.
And spoke very highly of how they were treated, had a good outcome, was very positive about all the staff that they interacted with, including Dr. Cheney.
Of course.
But I think it illustrates something. We are safe.
Yes.
Don't put things off. Get the care you need.
And it sounds like initially he had put it off and then came back, and he was very happy he came.
He did. He was happy he did.
Yeah,
so
very good.
Thank you for that letter to the editor in the Gazette.
For sure. And to Dr. Cheney and the team. Great job.
Absolutely.
All right, good. All right, so We'll be back again on Tuesday with new numbers and new information. We hope you have a good weekend. We ask that you please, once again, take care of yourself, take care of each other, and we'll see you next week.